and I am your nurse for today. May I know your name, sir?
I'm Christian Garcia.
Okay, sir, Christian. So I am here, sir, to do a set of observation on your abdomen, sir. So we will be doing the inspection, auscultation, percussion, and palpation, sir. Are you done urinating, sir?
Yes.
Do you have any painful areas in your abdomen, sir?
No.
So don't you worry, sir, because this assessment will be remain confidential and adequate privacy is given to the patient. Do you have any concerns, sir, or problems about our assessment?
No.
Surveying the abdomen. Position the client in a supine position. Cover the upper and lower body parts with a bed sheet, leaving the abdomen exposed. Observe the abdominal skin. Note for any vascularities. Note for any stray. Note for scars, lesions, and rashes. Note the history of scars and document its location by quadrant. Inspect the umbilicus for its color, contour, and location. Examining the abdomen inspection. While the client lies flat or supine on the bed, sit beside the client. Look across the abdomen at a level slightly higher than the client's abdomen. Inspect the abdominal girth. Inspect the area in between the lower ribs and pubic bone and note for any abdominal enlargement. Measure the abdominal girth using a measuring tape and at the same time of the day, ideally in the morning. Ensure that the client has emptied his or her bladder. Position the client in a standing or in supine position. Client's head may be slightly elevated for orthopneic patients. Use a disposable, easily clean tape measure. Place the tape measure behind the client and measure starting on the umbilicus. Record the distance on designated units. Take all future measurement from the same location, especially for noted distension. Mark the abdomen with a ballpoint pen to aid in measuring site. Ask the client not to wash the mark until it is no longer needed. Check for symmetry. Ask the client to raise his or her head to further assess for herniation or diastasis. Inspect the abdominal movement when the client breathes. Observe for peristaltic waves. Auscultate for bowel sounds. Use the diaphragm of the stethoscope and make sure that it is warm before placing on the abdomen. Apply light pressure or simply rest the stethoscope if the abdomen is tender or painful. Perform auscultating starting with the right lower quadrant, then clockwise quadrant. Listen to each quadrant for 5 minutes, minimum 1 minute per quadrant to confirm any absence of bowel sounds. Note the intensity, pitch, and frequency of the sound. Auscultate for vascular sounds. Use the bell of the stethoscope to listen for breathing. Auscultate for venous hum. Use the bell of the stethoscope to listen for venous hum in the epigastric and umbilical areas. Auscultate for friction rub over the liver and spleen. Place the diaphragm of the stethoscope over the right and left lower rib cage and listen for friction rub. Percussion. Percuss for tone. With the percussion hand technique, lightly and systematically percuss all quadrants. Percussion may be proceed clockwise or up and down over the abdomen. Percuss the span or height of the liver by determining its lower and upper border. Determine the lower border by percussing beginning from the right lower quadrant at the mid-clavicular line, then upwards. Note the change from tympani to dullness. Assess the descent of the liver. Locate the liver border of dullness. Observe for the descent of the lower border of the liver below the costal margin in deep inspiration, and the client hold his or her breath. Percuss the upper border of the liver. Locate the upper right chest at the mid-clavicular line and percuss downward. Mark the point where change from the upper right chest, lung resonance until the liver of dullness is noted. This is the upper border of liver dullness. Measure the distance between the two marks. This is the liver span. Repeat the percussion of the liver at the mid-sternal line.
Can you take a deep breath, sir? Inhale.
percuss the spleen. Begin percussion on the posterior to the left mid axillary line and percuss downward. Note the change from lung resonance to splenic dullness. Perform a second method of percussion to determine enlargement by asking the client to take a deep breath and start percussing on the last left interspace at the anterior axillary line.
Sir, can you take a deep breath, sir?
Blunt percussion on liver. Place the left hand fist against the lower right anterior rib cage. Use the ulnar side of right fist and strike the left hand. Note for any tenderness upon percussion. Blunt percussion on kidneys. Ask the client to sit with his or her back to you. Place the left hand on the costovertebral angles. Test for abdominal distension or bulging flanks or ascites. Percuss the flanks from the bed upward toward the umbilicus. Note the change from dullness to tympany and mark this point. Assess the client to turn into the side. Percuss the abdomen from the bed upward. Mark the level where dullness changes to tympany.
So we're gonna start percussing right here and percuss upward toward the umbilicus. And note the change from dullness to tympany and mark the point. So there's the tympany right here. So we're gonna assess the patient to that in the right side. So we're gonna percuss the same. And also note the change from dullness to tympany and mark the point.
Perform fluid wave test. Ask the client to place the ulnar side of his or her hand and the lateral side of the forearm firmly along the midline of the abdomen. Firmly place the palmar surface of fingers and hand against one side of the client's abdomen. Use the other hand to tap the opposite side of the abdominal wall. Note for any fluid movement. Palpation. Position the client back in a supine position. Cover the upper and lower body parts with a bed sheet, leaving the abdomen exposed. Begin palpating on a non-tender abdominal quadrant. Use fingertips to compress the quadrant to a depth of 1 cm in a dipping motion. Lift fingers gently and proceed to next quadrant B169. Begin palpating deeply all quadrants to delineate organs. Use the palmar surface of the fingers to compress quadrants to a maximum of depth of 5 to 6 cm. Note for any resistance or any deeper structures. Palpate for masses. Use fingertips to compress all quadrants to a depth of 1 cm in a dipping motion. Note for any masses and its size, location, shape, consistency, demarcation, pulsatility, tenderness, and mobility. Palpate the umbilicus in its surrounding. Note for any swelling, bulges, and masses. Palpate the aorta. Use thumb and first finger or use both hands to palpate deeply the aorta. Assess for pulsation. Palpate by hooking. Stand at the right side of the chest. Curl the fingers of the both hands over the edge of the right costal margin. Ask the client to take a deep breath and gently but firmly pull inward and upward with your fingers. Note for consistency and tenderness. Test for cholecystitis. Press fingertips under the liver border at the right costal margin and ask the patient to inhale deeply. Note for right upper quadrant pain and tenderness.
Take a deep breath, sir. Take a deep breath, sir. Do you feel any pain, sir?
Palpate the spleen in two-way method. Method 1. Stand at the client's right side. Reach over the abdomen with left arm and place left under the posterior lower ribs and pull up gently. Place the right hand below the costal margin with the fingers pointing towards the client's head. Ask the client to inhale and press inward and upward while providing support with the other hand. Note for consistency and tenderness.
Do you feel any pain, sir?
No.
Perform hypersensitivity test. Stroke the abdomen with a sharp object or grasp a fold of your skin with your thumb and index finger and quickly let go. Note for pain, exaggeration, skin reaction.
Just tell me if you feel any pain, sir, ha? Do you feel any pain, sir? Do this several times and note for complaints or pain exaggerated.
Test for psoas sign. Ask the client to lie on the left side. Hyperextend the right leg of the client. Note for pain and reaction of the client.
Sir, can you lie on your side, sir? We're gonna extend your right leg, sir. Do you feel any pain, sir?
Nothing.
Test for obturator sign. Hold and support the client right knee and ankle. Flex the hip and knee and rotate the leg internally and externally. Note for pain and reaction of the client.
First thing first is to raise the right leg of the patient and support the knee of the patient. And flex the hip and knee and rotate it gradually. Do you feel any pain, sir?
Test for appendicitis. Assess for rebound tenderness by palpating deeply at 90 degrees into the abdomen away from the painful or tender area. Suddenly release pressure, listen and watch to the client expression of pain. Ask the client which hurt more, the pressing in or releasing. ask the client where in the abdomen the pain occurred.
Okay sir, I will apply a pressure here sa... Do you feel any pain sir? If the patient feels any pain, ask him or her what hurts more, the pressing in or the releasing one.
So here's the summary of our findings, sir. So in observing for your abdominal skin, sir, the skin is good. Vascularity of your abdominal skin is not visible. There were no stretch marks and scars, and no lesions or any rashes. In inspecting for your umbilical skin tone, sir, umbilical skin tones are similar to the surrounding abdominal skin tone. Abdomen is flat, symmetric, and doesn't bulge when you raise your head, sir. And when we inspect for your abdominal respiratory movement, sir, abdominal respiratory movement is normal, and normal aortic pulsations and normal peristaltic waves. In auscultating for your bowel sounds, sir, a series of intermittent soft clicks and gurgles are heard at a rate of 20 per minute. Bowel sound occur every 10 seconds, which is normal, sir. In auscultating for your vascular sounds, sir, there were no breathing heard over the abdominal, aorta, or renal, iliac, and femoral arteries. In auscultating for the venous hum, sir, also there's no sound heard over the epigastric and umbilical area. And when we auscultate for a friction over the liver and spleen, there's no friction over the liver that is present, which is a normal finding, sir. In percussing for tones, sir, symphony predominates over the abdomen. This is because of air in the stomach and intestine. In percussing the span or height of your liver, sir, by determining its lower and upper borders, your lower border of liver dullness is located at the costal margin of 1 to 2 cm below, which is a normal finding, sir. In deep inspiration, sir, the lower border of your liver has descent from 1 to 4 cm below the costal margin. The upper border of your liver dullness is located between the left, fifth, and seventh intercostal space. Your liver span at the midclavicular line was 6 to 12 cm, which is a normal finding, sir. And when we repeat the percussion of the liver, sir, at the mid-sternal line, the liver span is at 4 to 8 cm. In percussing the spleen is an oval area of dullness, which is approximately 7 cm wide, which is a normal finding, sir. In performing the blunt percussion, sir, on the liver and the kidney, there's no tenderness elicited or pain reported by the client. And when we perform light palpation, sir, the abdomen is non-tender and soft, and there are no guarding. In deep palpation in all quadrants, there's no tenderness over the xiphoid, aorta, cecum, and the sigmoid colon. And when we palpate for masses, sir, there was no masses that is present. And when we palpate for the umbilicus and the surrounding area, there's no any swelling, bulges, or masses. In palpating the aorta, sir, the aorta is in 3 cm wide with a moderate, strong, and regular pulse, which is a normal finding, sir. In palpation of the liver, sir, the liver is usually not palpable, also the kidney and the urinary bladder, but it may be felt in some thin clients, and also the spleen, which is seldom palpable. And when we test for ascites, sir, when we test for the shifting dullness, the border between tympany and dullness remain relatively constant throughout the pulsation changes, which is a normal finding, sir. And when we perform the fluid wave test, sir, there's no fluid wave that is transmitted, which is a normal finding. And when we test for appendicitis, there's no rebound tenderness that is present. And when we test for the Rov signs, there's no rebound pain. And when we assess for the psoas signs, sir, there's no abdominal pain that you felt, which is a normal finding. When we assess for the obturator signs, sir, there's no abdominal pain that is present. Also the same in the hypersensitivity test and the cholecystitis, sir. So that's all, sir. So it was a very good assessment, and I must recommend you that you must continue your daily exercise to maintain these good results, sir. So that's all, sir. Thank you for your cooperation and have a nice day.